Is it okay that I haven't kept the sublingual drops in the fridge? I want to make sure it's still safe to take. So this is really interesting. So there are rules in the UK that when we make things inside the pharmacy, rather than have been made in the factory, that we have to apply certain standards to those. So, for example, our 1 milligram per 1 ml liquid, which is made in the pharmacy, was sent away for analytical testing to enable us to have up to 12 months stability at room temperature. So we know if you don't open a bottle of the 1 milligram per ml and you leave it on the counter at 20 degrees centigrade for 12 months, it will be absolutely fine at the end of 12 months. However, the sublingual drops are formulated to have as little excipients or as little additives to them as possible. So those are recommended to always be kept in the fridge and to be discarded after the 28 days once they're opened. Now, if it's unopened and it's been kept out of the fridge and not been opened at all, I wouldn't have any problems with using that. But once you open the bottle, really 28 days is the time you probably should be discarding that. Just order a repeat prescription from you, but we're having terrible trouble with Royal Mail, who isn't? But how long is it okay for LDN to be out of the fridge? When it's sealed for the LDN 1 milligram per mil, it's 12 months. So I wouldn't worry about it. It's not going to, there's no way that one supply there's going to be a problem if it's delayed by a few days. Do you need to keep LDN liquid 1 milligram per mil in the fridge, or can it stay in a drawer? Sorry if this is a silly question. So no questions are silly, Peter. This is a bit complicated, but the regulations in the UK recommend that we stamp everything that's made separately from outside of a license to keep it in the fridge. But the stability for the 1 milligram per mil liquid is 12 months at room temperature. Now, that's fine when it's closed, but if you're opening it to the air and letting bacteria in, and you are pulling your syringe in and out that has bacteria on it, there is a risk that you're contaminating that liquid every single day. So if you're not keeping it in the fridge and you are using it every day, I wouldn't keep it for longer than a month. So use it for that period of time, but don't keep it out of the fridge having opened it for longer than that period of time, because bacteria could grow that you've introduced using the syringe, and it could make the medication go off or make you sick.